Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Amanda Smith about her upcoming presentation here for the Gold Neonatal Conference. Welcome, Amanda.
Hi, thank you.
It's lovely to have you here. Yes, we are busy with the Gold Neonatal Conference, online conference that will get started here May 30th. It's just around the corner. And you will be presenting here live with us on June 13, right, Amanda?
That's right.
So tell us, first of all, where in the world are you?
I am based in the UK, so about a couple of hours north of London.
A couple of hours north of London, and you were just
Yep.
telling me off camera that the weather is not as good right now.
No, it's not today. That may be all we get of sunshine that we had yesterday for a while.
Sunshine in spring. Well, Amanda, tell us a little bit about, now that we know that you are working and practicing in the UK, tell us a little bit about your background and the work that you're doing.
So I'm a registered children's nurse, but pretty soon after qualification, I started working on the neonatal unit, and in the UK we can become what we call qualified in specialty as neonatal nurses. So even though I have worked on children's wards and in the community with children as well, primarily my post-graduation experience has been on the neonatal unit, so right across from intensive care all the way through to the community. And for about the last 5 years I've really focused on the community from babies who have been on the neonatal unit. And I am an IBCLC as well, having been a peer supporter just after I had my first baby, who's just over 13 now. And I trained as a tongue-tie practitioner as well. But yes, currently I work on a neonatal home care team.
Wonderful. Well, you're wearing lots of hats there, Amanda, also tongue-tie specialist and IBCLC as well as a nurse there. Tell us more about the home, the way your hospital provides that home service that you mentioned, because I hear from lots of neonatal providers that the little ones, they go home, they're being discharged. And, often the care provider who've cared for this little one for quite some time doesn't know what the outcome is, what happens to them, right? And I believe you have a really nice program that really follows the little ones home and makes sure that their journey is going well. So tell us a bit about that.
Yes, so the unit that I work on is it's 2 units, so a level 3 with the earliest and sickest babies that have had surgery, and also a level 1. But our network of neonatal units also cover a local neonatal unit as well, and we are one big team. So we facilitate earlier discharges, but ensure that they're safe discharges as well. And we try to ensure that the families are involved as the center of their baby's care team throughout their neonatal stay, so that as soon as those babies are stable enough to go home, whether they have a tube in, but the parents have been giving tubes throughout the neonatal stay, or they may have home oxygen, or we've just started a new service with home phototherapy, so babies don't have to be readmitted to hospital
Wonderful.
if they need phototherapy. So we offer quite a few sort of different pathways, but it means that babies are able to be at home with their families as soon as possible.
That's beautiful. That's absolutely wonderful. It sounds like a beautiful program there. Now let's also talk about your presentation, Protecting Breastfeeding by Facilitating Safe Early Discharge from the NICU with Home Nasogastric Tube Feeding. I can imagine that this, first of all, is fascinating. It's wonderful that babies can be sent home with a nasogastric tube and will be able to breastfeed, or that this is supported. So tell me a little bit about that program, how it works, and tell us a bit about the presentation too.
So what I'll discuss with the presentation is about the program itself, and selecting those candidates for home tube feeding, and then setting that up, and I'll talk about the benefits for the families and for the facilities as well. But it does mean that, like you say, those babies can go home with a tube, but there is then not that pressure to introduce a bottle so that they're having all oral feeds. Different home care teams have different criteria, but we like for babies to at least have 2 oral feeds in a 24-hour period for a couple of days, because that shows us that yes, they can feed orally, but they just can't do all of their feeds orally just yet because they're premature. So we visit them a couple of times a week, and that gives us a chance to keep an eye on their weight and update that feeding plan. And just so it's that gradual transition from mostly tube feeding to the breast, or whichever way the parents are hoping to feed their baby.
Absolutely lovely. And especially that it can be done at home in their surrounding, because I can imagine this is also good for the parent, right? Like being in
Absolutely.
being instead of being there in the NICU with a little one, which is a stressful environment. You know, there's other families around and other little ones, and you know, all the instruments that can be very intimidating and very tiring for the parents, and very emotional as well. So being home with a little one, being able to get these feeds and the bonding and everything that comes with it as well, it must be very, very beautiful.
Yeah, I think it makes a big difference for the families that they have, you know, for some of these babies, they've been coming in for weeks, if not months, driving into hospital, having to pay parking that may be subsidized. Some hospitals may not be at others. You know, they're having to sort food out while they're there. If they have older children at home, they're trying to organize that. Sometimes parents have to go back to work as well in that time. So it may just be one parent that can primarily visit the baby, but this gets the baby, you know, where they need to be, which is at home as a family unit sooner.
As the family unit unit. I love that. Thank you so much, Amanda. I'm looking very much forward to this presentation and learning from you. And thank you so much for being here today and chatting with me about about your presentation.
No problem at all.
And now some information for our viewers. This presentation is part of the Neonatal Online Conference of 2023. As I said, our keynote presentation will be live May 30th. All our presentations are always recorded, so if you cannot be there live, everything is there for you to watch at a date that it's convenient. And this presentation, Amanda's presentation, will be live June 13th. So if you want to find out all the information on the conference, we would like to invite you to go to goldneonatal.com for all the information there as well. Thank you, Amanda, and thank you everybody for watching. Bye-bye.